Hi, this is Dr. Sinagra from the Sunrise Wellness Center, and I'm here with my patient, John Byrne. Hi, John. How you doing, buddy?
How's it going?
I'm glad you're here.
Thank you.
I got a very special guest tonight, and John's a special patient. We become friendly because John was suffering with one of the worst cases of psoriasis I had ever come across. Now, for the patients that have watched any videos of Sunrise Wellness, I'm a psoriasis patient myself, and one of the reasons my office became a wellness center was my own quest to understand psoriasis, and then I came across what we do now and started the wellness center. Well, John, when we first met, you had some of the most severe cases of psoriasis that I had ever seen, and our video man, Holden, is going to be showing photos of you prior to coming to my office over the past few years as we speak. And these photos were taken a few years ago, but when I first looked at your photos, I thought you were a burn victim when I first looked at your legs. Why don't you tell me a little bit about your past and your condition?
Well, the psoriasis started about 4 to 5 years ago, and I've never had any kind of skin condition ever. And it was just progressive. I went to numerous dermatologists. One actually said, well, did anybody ever do a biopsy? And I was like, no. So once they did a biopsy and they said, yes, you have psoriasis. So I was just, so we started treating it. But none of the treatments, the topical steroids, the shots, the steroid pills, nothing worked. Side effects, it would work for a very brief period of time, and then it would just flare up even worse.
What were your symptoms besides the red scaliness? You said you suffered with lots of itching at night.
It was itching at night to the point of literally, there was no stopping. Once it started, you couldn't stop, and it would just like rip your skin. I was literally ripping my skin off, and it would come off, it would just like flake off, and I would bleed, and then it would burn, and it was burning so much that I would have to turn the ceiling fan off. I couldn't have any kind of airflow, because any kind of little bit of airflow would just like a burn victim.
So your skin was that sensitive?
Yes. So
how did you find my office?
My wife, through a friend at work.
Okay.
She said, there's that, he helped a patient of hers, a friend of hers, and she said, why don't you go see him? So I've done all the medical, stuff, and I said, I want to try the wellness. I'd rather do that.
So you first started in my office at late April, and we didn't really actually start the program until like early May.
Correct.
So now we're just into early July of 2022. So I was pretty surprised when you started to respond so fast. Now, when I take care of psoriasis patients, I tell them we don't treat psoriasis. We get to the root fundamental cause of autoimmune disease, which starts in the gut lining, and something called dysbiosis. So we started rebuilding your gut and bringing up all your micronutrients that were low, and you were low on so many nutrients, and your gut was very, very damaged. In less than 3 months, now it's a 6-month program we put psoriasis patients on because psoriasis does take time to correct. But in less than 3 months, how you doing?
Unbelievable. I mean, if I could show you. Sure
you can.
This whole part of my arm, as you've seen in the photos, this whole part was just covered in scabs and oozing. It was to the point where sometimes I just didn't want to go outside because I just couldn't. I would be scratching so much, and it would ooze and bleed, and it was awful.
Now, also, I noticed
and my legs too.
Your left forearm, when I first met you, hold up your.
It's almost clear.
That's almost clear.
Yes.
Which is now this is less than 8 weeks,
yeah.
Correct? So May, June, and so I'm sorry, a little bit more than 8 weeks. And that's one of the things I like to do in the testimonials is I like to have patients come in before the program is done and show people that along the way you're starting to progress. Did you have any other symptoms besides the psoriasis and the skin itching?
Well, I also had neuropathy, my lower extremities.
Well, that's huge.
Yeah.
That's a big one.
Yeah,
How long did you suffer with neuropathy?
That was probably about 3.5 years. of having it.
And how much improvement has that had?
That is, I've gotten most of my balance back because I was losing my balance because I couldn't feel when I was walking. If I walked on the concrete, I was fine. But if I walk in grass and I can't see the elevations, I lose my step.
Yes.
So that's coming back. Nighttime was always the worst, where I would lay down for bed and then it would just start, and that has subsided significantly. I mean, I'm falling asleep like a normal person would instead of just sitting there moving around trying to get a comfortable position.
You know, when we first met, I told you our approach was going to be not to treat malfunction, but to restore function.
Correct.
And with the neuropathy in your legs and some of the other symptoms that you had, I said, look, your body knows how to heal itself if we do the right thing, if we give your body what it needs to heal. And lo and behold, things like neuropathy and things, we didn't do anything for neuropathy. We didn't do anything specific for these conditions except get your body functioning properly. The results have been phenomenal. I mean, I'm blown away myself because you've done so well, so fast. And I wanted to share your case today, and thank you so much for coming in.
It was my pleasure. I can't, I was giving gabapentin for the neuropathy. And I know what gabapentin is, we all do. It's a narcotic. And I don't like taking narcotics. And when you said there's another option, and it's non-narcotic, it's all natural, I was like, let's do it.
And your program's 6 months. You haven't even hit the halfway mark.
No.
You're going to do phenomenal. Would you recommend the program for people that are suffering?
Absolutely. This is a godsend. Is the only way I can say it. Is an absolute godsend.
Well, John, thank you so much for
My
coming
pleasure.
in today. It's a pleasure.
Thank you very much.
Thank you so much.